Thanks for joining us for another edition of the Chapters Health System Q&A. My guest this week is Rebccea Jensen. She is the Director of Inpatient Care for LifePath Hospice. Certainly right there on the front lines with all of our healthcare heroes. How you doing, Rebccea?
Good. We're doing good. We've got our 3 inpatient units. We have a really good team. They're holding up very well. We've got a lot of education that we're doing, a lot of one-on-one if they need a little bit extra time to talk, because this is a challenging time for all of us. It's very stressful.
Yeah, I mean, we're going on probably a full month now, if not more, of the COVID-19 pandemic. What are some of the changes you've seen inside the hospice houses?
Well, it's had a lot to do with visitors. We are only allowing 2 visitors at a time at bedside, and that can be challenging when we're dealing with end-of-life issues, because we're used to having groups, sometimes of 30 people in the house at a time that are with this family member. And with our COVID patients that we do have, we are allowing 1 visitor, but that is the only visitor that they're allowed. So we're having, visitation through the window. We're having where, the loved ones, can be able to see via FaceTime, which can be very challenging because it's end of life and we really want that family to be there. So that's a definite change. It's challenging for our nurses because our nurses really want the families to be there, and to sit and someone while you're holding their hand while they're passing can take a real toll. That's why I have such an incredible team and such a strong team that they're doing a wonderful job with these patients.
That's great. From a safety perspective, you mentioned only 1 visitor. What else is different inside the hospice houses?
Well, it's the 2 visitors for a regular patient, and 1 visitor for the COVID patients. The other safety features are, of course, the nurses are all wearing masks with patient care. The instituted just today is all of the visitors are now wearing cloth masks when they come into the facility. We also take temperatures on every staff member, every vendor, every visitor, and if they're above 99, they're not allowed into the facility. Unfortunately, they do have to stay out. So there's some of the safety things. Wound scrubs as well. We do have scrubs available for any staff that are on the COVID wing. Once they're done, we take those scrubs, they change out, they go into their regular clothes, and then we wash those scrubs for them, and that way they decrease the exposure that they might have to their family.
Okay. What are some of the differences maybe between one of our LifePath hospice houses like Malesh or Sun City versus what's going on at the unit at Tampa General Hospital?
Well, Malesh, of course, is the COVID wing, so we are a little stricter with visitation on the page. Sun City remains the same. We are ready and able to take COVID patients here if the need does arise. We have scrubs. We are ready. At Sun City, we're taking temperatures too. We're doing all the vendors, all the patients, and well, of course, the patients, but staff, visitors, and we are still limited to 2 visitors here. But right now, there are no COVID patients. At TGH, the temperatures are checked by Tampa General upon entering, and everyone is given a mask, and all staff and all visitors are required to wear a mask at all times. Tampa General has stopped all visitation altogether unless a patient is imminent, and then we can have 2 patients, family members, come up briefly, and that's a bit of a challenge, but TGH has been incredible with us and working very closely with patient that's there and getting those patients' families the ability to come up and spend their last moments with them. A little difference between each house.
Yeah. I know everyone and the support side of things has been working really hard to gather as much PPE as possible, whether it be gloves or masks or sanitizers. And I know they're working hard to distribute that to the different locations on a daily basis. Do you guys feel good with what you have? Do you feel like you have everything you need right now?
Absolutely. I cannot say in enough words how supportive Chapters has been with distributing the PPE. We feel very comfortable with the amount that we have. The staff have plenty at their disposal to be able to go in and care for these patients safely. So I feel blessed to work for this company, to be honest.
Well, that's good to hear. We're seeing a huge outpouring of support, places like social media, things like parades or signs or chalk art. Healthcare workers are really kind of in the spotlight right now, and rightfully so, getting some recognition. How are you finding morale in these different locations?
It is funny how a single sign can make so much difference. So we had signs placed by foundations that just were, hey, you guys are doing a great job, you're heroes, passing through these doors, are great caregivers. The sidewalk chalk that the volunteers have done for us, the food that our area donors have provided, and our foundation has provided, has really boosted the spirits of all of the houses. It's kind of funny how a little bit of food will make a nurse happy. It always does.
That's great. And you don't need a pandemic. You guys, you'll take it all the time, right?
Exactly. We love food. We love chocolate.
All right. Well, Rebecca, thank you so much. It's good to see you in good spirits, and I know you're keeping everybody in good spirits across our LifePath Hospice network. Thanks so much to everyone for joining us for this week's Q&A. We'll see you next week.
Thanks. Appreciate it.